So, hello, welcome everybody to the new series we're having here at CESI. We launched a series called CESI Insides, the impact of coronavirus on different experts from the point of view of different experts from our member organizations, and also to have some personal testimonies. I look very much forward today to welcome Milena Popović. Milena is she's been a qualified epidemiologist now for almost a year, but most importantly, also she's president of the Montenegrin Physicians Association, and she has been, which has been member of CESI for I think 3 or 4 years. Meanwhile, hello Milena, how are you doing?
Hello to everyone. Very well, thank you. Still very well.
How do you experience now the current crisis in Montenegro, both as a physician, but of course, especially as an epidemiologist, and also as from a private perspective?
Challenging. So the hardest part of all this situation was how to change people's habits, how to change everyday routine people use today lives, and everything has to be changed in 24 hours. And how to be convenient, how to convince them that they should act according to the measures that we are recommending. Lack of personal protective equipment here in Montenegro and in all the world around in the first days induce panic between healthcare workers, panic between patients, new protocols, new way of thinking, new way of admission patient to the hospital. Everything has been changed, and that creates in first days that creates a little bit chaotic atmosphere, and that induces the panic. So right now, the situation is a little bit better. I'm in charge for small town, Cetinje. Right now I'm working like IPC epidemiologist, that is infection prevention control epidemiologist. And also I'm epidemiologist who is responsible for detection of infection with the SARS coronavirus 2. And I'm in charge to protect everyone from the spreading of that infection to the others. And so far we don't have any cases in our town. All our healthcare staff, they are very healthy. They're all good. Even we are taking care of patients from all the Montenegro. So we are good right now.
Milena, my question to you as an epidemiologist, we all know how, I mean, when we think back to the months, to the previous months or weeks, I mean, we're living a different life now, in a different world. And when we still think of both what virologists, epidemiologists, but also politicians said, maybe until the end of February, that the dangers, for instance, of coming from coronavirus were low, or that some politicians said, yeah, we have the first cases, it's just like having a small cold. How could it happen that I really don't want to finger point anyone, but how could such error happen in the assessment, basically, of the current corona crisis?
Okay, yes, everything you said, it's a good point of view. We still have a much stronger, much influential board of politicians and leaders. And everyone listen what they say, and they hear very well what they say. But how many people listen and how many people hear what scientists say, what doctors say? We all know what some kind of, I don't know, president from some country, he has his own interpretation of this situation. But have we heard the word of professional? Do we have system which brings those issues through the professionals from their point of view, from the analysis, which are scientific. No, we had a lot of words like we are some part of political campaign, and we lost a lot of time during that campaign. But I hope we now hear professionals.
Yeah, I still have also had some discussions also with some sociologists who also, well, shared the views that maybe it was also a general feeling of our societies, maybe of our Western societies, to be a little bit more, or let's say, unattackable or untouchable. And we kind of looked to Asia, and particularly to China, thinking this is a mere Chinese problem. And it's still amazing to me, not being an expert, how this misconception, how this whole drama, how this whole situation, how this whole danger could be so severely underestimated. Milena, where do you see the role of trade unions at this very moment? Are they playing an important role, especially the trade unions of the personnel of the public health sector? What is your feeling? What is your opinion?
I think that trade unions are the greatest. One of the greatest importance is how to involve as many professionals as we can. Trade unions are built from professionals. Our trade union, our members are doctors. So we can provide expertise, we can provide knowledge, and we would like to do that, As I already said, okay, these are not regular times. There is a time for politics and for politicians. These are not those times. This is a different moment, as we are asking from the people to act differently, as we are asking from them to change the everyday routine. The same way we should ask politicians. They should be our voice right now, the voice of professionals and the doctors who have an idea how to treat, how to act in this situation. And in order to do that, we need a personal protective equipment. You have countries which were involved in all these disasters unprotected, with healthcare which were not protected. Without personal protective equipment, you are losing hospitals. You are losing the chance to provide to your citizens healthcare. So the first step should be how to provide enough protective equipment to the healthcare workers so they can provide their help to the patients. Every country which did not do this, which did not done this preparation, was in problem. That brings problem.
Of course, yeah. When you have hospitals, a situation that in hospitals, nurses or doctors or all the personnel working there is not protected, then you have a perfect incubator and the perfect epicenter for the propagation, of course, of the virus.
Frank, one thing I would like to add. There was a lot of misunderstanding, between the recommendation that we received. World Health Care Organization, WHO, they made recommendation about using masks. They made some kind of how to rationalize using personal protective equipment. I am not sure that was a good proposal. I don't know how to call that plan. I think that plan could be part of the problem, because in that plan you can read that healthcare workers who are working with COVID patients, that they can wear only a surgical mask. Only if you do intubation, you have to have a FFP2 or N95 particular mask. I don't think that this was a good strategy. I'm not sure that they should publish something like that, because that made a lot of confusion. In my hospital, every healthcare worker who work with patient does have a particular mask, and because of that, everyone are healthy. We do. Every hospital has its own problems, and so on. But our priority must be how to protect healthcare workers, because without them, without doctors, without nurses, you cannot help anybody. You cannot help yourself and anybody.
So it must be even more important to provide those workers, healthcare workers, with masks than because now more and more it is being suggested that everyone who's going out of the street should wear masks, who's going to a shop should wear masks. Of course, that might make sense, but that also leads to masks becoming less and less available altogether. So, but of course, this is probably what you meant, despite the fact that in hospitals you need.
Yeah, I'm sure that they wanted to protect that market of the mask because there is a lack. Yeah, but we had healthcare workers without masks, and we had the citizens without masks. You know, so okay, we should maybe more eager to then convince people that they should really do that physical distance, that they should really do that social distance. We should do something. If we don't have masks for healthcare workers, we don't have masks for people, we should do then something else, because that is the way you can protect yourself and others. And I think in my town, I ask people to wear masks when they go to supermarket, and to do disinfection of their hands when they are in supermarket, when they are entering and when they are going out of the supermarket, not to wear gloves just. Because you know, you think you are protected, but what lives on these gloves? You don't know that. What you should do, you should disinfect your hands.
Is there something I've come several times to Montenegro, and we discussed also the situation of both doctors and nurses and the overall situation of public health in your country. Is there something which can be learned from the crisis also for the future, for the equipment or for the investment in the public health sector? Is there some lessons which can be learned?
Oh yes, of course. I think we should learn a lot of lessons. Perhaps we did not pay attention to this threat early enough. I don't know why we do that in all Europe, how that happened, but what can be pointed? We are investing a lot in military industry, for example, and we don't have a system which should provide prompt response to the pandemic disasters. We are not thinking about that, we are not investing in that, and those threats are all around us all the time. Pandemic influenza or flu, it was threat also. If we have mutation of the virus, this could happen, but it was corona, not influenza. So what we should do, we should have a team of epidemiologists, a team of medical workers, you know, and those medical workers should be ready to go to the place where first case show up. I want to point this, infection disease don't recognize borders and nationalities. So I think we should learn something from these microbes. These teams should do the same, yeah? We need to do and to act together on these issues, because if microbes are concerned of all of us, not only for the stricken country where first cases showed up. We must think, okay, this is China, but tomorrow it will be Montenegro or Spain or Italy or Germany. And we need to do that prevention while it is still in China. And we need to act together, and we need to have professionals, medical team workers, epidemiologists who would act prompt together on this. And I think we should learn that from microbes in this situation.
So not retracting to the national level, but really opening up and exchanging and learning from each other. Milena, message to the citizens in your countries, but also to the citizens of all over in Europe, or maybe all over in the world?
We should act as one family, as one united country, not as a lot of countries, nations, and I don't know how to diverse all of all of that. I think we should do exchange of knowledge very fast. All the informations, provide help in protective equipment, in knowledge, in staff, even though because Italy was very hard stricken with this, and I think we should provide them help much earlier than we are doing now. So accent would be on measures. That is the best we can do right now. I know that this change people's life. It is very strange because some kind we have limited basic human rights, and we are asking, okay, is this going to have impact on future days? Yeah, because once when you experience those limitations, it is tricky. Maybe people can use to that, and that would not be a good thing to do. So right now we have to do this fast, efficiently enough. So I think we should do these preventing measures. Please keep the social distance. It is physical distance. So please keep the physical distance to the other people, and help clinicians not to have too much cases in intensive care units. And one day I think we will have crude immunity that will stop this pandemic. So that would be it.
Thank you, Milena. Last message to the CESI community as we speak of community from your side.
Yeah, greetings to CESI family, and thank you for all the help. CESI connecting people, and that is the most important thing in these days. All that we said, exchange knowledge, to be supportive to each other. That is what CESI provides. I think there is some other kind of organization that are doing the same. So let's do that. Let's be the part of one family, not to make parts. And that would
be. Thank you, Milena. Thank you very much for your time. Take care of yourself. Take care of your family. Take care of those who are hit, of course, by the virus. And we wish you all the best. And we look forward to hopefully seeing you very soon again under normal circumstances. Yeah.
I hope.
Okay.
I hope so.
Bye. Take care. Bye.
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 Bye.